Hey, good morning, everyone. So if you're new here, I'm Monica. I'm currently a summer nurse intern on a medical surgical floor, and I also graduate in December. So it's been a while, I know, but I wanted to update you guys because I'm halfway done with my internship. I know, that's so crazy. It's a 10-week program, and we're already halfway done. Like yesterday, we had our halfway done, kind of day where we went to a hospital, all of us interns, there's about 80 of us, and we kind of talked about what we did, what we want to learn, our goals, how to get hired there, that kind of thing. So yeah, and yesterday was also my birthday, so I had a lot of fun. And so today I'm actually going to go out and go to Ulta and Sephora, because if you don't know, if you're a member there, it's completely free, but you can get a free birthday gift at each. So I'm gonna go do that because I gotta get my stuff. I'm a college student. I still like to get free stuff. So I'm going to go to Ulta and Sephora now and get that done. And I'm gonna go come back here, eat lunch. I'll update you guys, of course, on how my internship's going and eat some lunch and all of that. So I will see you guys soon. Okay, everyone, I'm back from Ulta and Sephora. So for my Sephora gift, they actually didn't have the Drunk Elephant skincare line one, which is the one I wanted, because that's the expensive stuff. So, but I got the Kat Von D. So it comes with a tattoo liner, translucent powder, and lipstick. I'll probably use the tattoo liner just because I actually ran out of liquid liners. That's actually perfect. But yeah, that was nice. I always take advantage of the beauty rewards there, for your birthday thing too. And then at Ulta, I actually got it's a mask. So I like these ones because then you don't have to peel off the mask. You know what I'm talking about, the peel off mask, not the wash off mask. So if you still have some crusty stuff in your hairline. So this will be interesting. I've never tried a high end mask. So this one's supposed to have a youthful radiance mask. So that will be fun. But anyway, so I want to tell you guys about my internship because I'm halfway done, which is so crazy to me because it's just flown by. So I've been working PM shifts, so 3 to 11:30, and then about 32 hours a week, 8-hour shifts. So I'm there about 4 times a week, and it's been so cool. So I'm on the medical surgical floor. And so it's just been really cool. I love the variety, which I thought I would love. But I've seen NG tubes, chest tubes. I've been able to put in IVs. I put in a urinary catheter. I've seen a lot of different disease processes and conditions of people come up to our floor. I've worked well with telemetry, which is putting the heart monitor on them, and monitoring their heart rhythm and everything. So I've really learned a lot, really good skills too. So that's been really cool. Oh, I put in 2 IVs. So that was so cool because that's something that I really wanted to do on this internship because I've never put one in before. And I think it's such a good skill for nursing students, especially to learn, because my school doesn't teach IVs just because they have the mentality that we'll learn it, or most hospitals have IV teams, but that's not the case. You know what I mean? Where my internship at, it's a pretty big hospital, and and they don't have an IV team. So I don't think everyone's gonna go to a hospital where you have an IV team. So I think it's really good to learn. But I got to do 2 of them. My first one, I did it on a patient, and this patient had nice veins, so that was good. So I got everything ready. I got my needle. You have to get your. All comes in the same kit, so it comes in, your saline in there. You've got your little clear, adhesive, not Band-Aid, but what I'm talking about, adhesive over it. Dressing, and then you have to get your needle size. So I did a 20, because you can do either a 20 or a 22. So the smaller the number, the bigger the needle is. So a 20, for example, is bigger than a 22. So I got a 20, and I felt pretty calm. I felt pretty calm about it just because like I knew if I was super nervous and I'd be like shaking and like not thinking, because I think that's what, you know, can happen sometimes if you're super nervous, that you're just not thinking. So I like, you know, took a deep breath before I went there. I went through the motions in my head of what I was going to do, what supplies I was going to do. You know, I got my needle ready. I had everything open with like my saline and everything. And I just like alcohol wiped it and went in. I got a flash of blood. So I was like, sweet. So I didn't, you know, like jam it in anymore. So I like drew back the needle, put, you know, it kind of is like a simultaneous thing. And then I hooked on the saline. I think that was the hardest part, honestly, is having to like unhook like the normal IV thing and put in the saline. I don't know the words to anything, I'm so sorry. And just put in the saline, clip it on, and then inject the saline to make sure like it works. And so that works. So I was like, yes! So I had to like, you know, tape it all up, and that worked so well. Like I was so happy. Like I just walked out feeling like so awesome. Like, yeah, I put in an IV. Like a lot of people from my school haven't put in, because at the hospitals near us, like you really don't. So I felt so cool, and yeah, so now like I put in an IV. And that was so cool. And so I actually did it twice. So I did another person I did an IV for. And I, you know, like, for older people, you know, it's like harder with their veins because they can like roll around. They're, you know, they're not as poppin' as like younger people are. So I just like took my time and I got it in. I got my flash and, you know, put it in. So that worked so well. So yeah, and I also put in a urinary catheter. So that was so cool as well. I don't know, like I just have good nurses at my unit who are really good about, if there's anything cool happening or if there's anything they want to see, they'll like pull me over. I am assigned like one preceptor nurse the whole summer, but a lot of the nurses, you know, are like really good about having me see other stuff. You know, like I've seen like chest tubes, how to work with those. They're really good about if there's any IVs to do, they'll call me over. So I'm just really lucky. Like my medical surgical floor is a really awesome floor, and there's some really awesome nurses as well. I think some big things that I've really learned is kind of getting into the hang of everything, you know, having 3 to 4 patients depending on, you know, the acuity. So like how much work are the patient going to need? Like, you know, do they have a lot of like frequent changes? Do they have like a trach or a chest tube or anything like that where it requires more care? So I've really learned a lot about those kind of things, and then kind of getting used to like time management. You know, like, you know, I have 4 patients, but everyone has an 8 o'clock med, so who's gonna go first? That kind of thing. So I always try to be like really productive and like do like all my assessments first, try to get those all done, and then go in for the meds. You know, people have diabetes, you have to make sure that they get their 5 o'clock usually and 10 o'clock blood glucose checks. So it's a lot of kind of like, and I think that I try to make like a checklist for myself to be like, do I have their assessment done? Do I have their charting done? Do I have their note done at the end of the shift? Just so I know. And then I have like everyone's when their medications are due. You know, I always go over like what medications they're giving, and so I know what it is. I think that's a big part too, and it can be kind of hard, especially if you don't, because there's so many medications. So I do have to look stuff up, of course, but just kind of like knowing what they're getting, and so what they're getting it for. It's always good to know, and then telling the patient like, oh, like this is what you're getting, like, you know, that kind of thing, so they know. But it's been really cool. I've really learned a lot. You know, like my assessments, you know, are way more productive and everything. Like working with IV poles, because, you know, like every hospital has a different IV pump, so getting used to that, and, you know, like making sure you have like everything good and doing the math for that and all that stuff. So I've just learned a lot. Like it's only, you know, I'm halfway done. It's a 10-week program, but I've learned so much, and it makes me feel so much more comfortable in that nursing role. So when I graduate, you know, I'm gonna like, you know, kind of get the flow of everything. Of course, that depends on what floor and like where everything is. You know, like some chucks are stored here, and like, and here's like the suction thing for that. And so that's kind of getting used to where everything is too. But I've loved it so far. I've really learned a ton. And it's been a really good experience so far, and I can't believe I'm halfway done, so, I've learned a lot, so I can't wait to get more. I know I've been doing bedside report too, so that's been good. And also too, like, every nurse has like a different thing of what they like for bedside report, so getting used to that I think is something. And also, like, what do you want to know, like, what do you want to do that. So yeah, I've really loved it so far, and I can't wait to see what happens next in my next in the next month until I'm all done. So that's gonna be crazy. Yeah. Oh, yeah. So, yeah, and then also yesterday too, we had our like halfway point intern kind of day, and we talked about like what our goals are and like what hiring is looking for, what human resources and nurse recruiters are looking for. So they basically told us, like, you're all probably going to get night shift and probably all not going to get, like, a 0.9, so that's 72 hours every 2 weeks. So I was like, oh. Like, I wasn't upset about, like, the night shift because, like, that's kind of what you expect. But, like, I don't want to work, like, 48 hours every 2 weeks. Like, I got to pay off my loans, you know what I mean? So I'm kind of nervous about that aspect because, like, like, I can't afford to work part-time, basically. So we'll kind of see what happens there. But yeah, I'm really grateful for this opportunity. It's been such a great learning experience. And yeah, it's been a great networking thing as well. Like, I meet the nurse manager. I have, like, I've met all these nurses and everything. So it's exciting stuff. So yeah, kind of makes me feel like more like a nurse, because for clinical you're basically there like 1 day a week or maybe twice a week. I'm not sure for you guys, but I've been at my clinicals like once a week, and so to be there 4 times a week, like, you really get the hang of it and like kind of just get settled into your own kind of thing. And like, there's so much learning to be done and new patients, and so that's really cool. So yeah, I'm gonna get dressed here soon and get ready to go to work because I have a shift today. So I will see you guys soon. All right, thanks. Okay, so I have about 10 minutes before I leave for work. So typically, having PM shifts, you're kind of your whole day is like you're like waiting to go to work and remembering. So I try to like do relaxing stuff. I'll try to do like some workouts, or I'll watch some Netflix. Or just, like, right now I'm, like, staying outside because, like, it's such a nice day out right now and so sunny that, like, when I'm in the hospital, I'm, like, looking outside, like, oh, why can't I be outside? So I try to spend my morning outside as much as I can, and just kind of relaxing and kind of making my lunch and getting ready for the day. So tonight sorry, I'm touching my hair so much, it just kind of looks a little frizzy. But I have chicken Alfredo tonight for dinner. And, yeah, so it's been beautiful day, and yeah, I'm just kind of getting ready for work. I work today and then I work tomorrow, so yeah, that's kind of my schedule. So yeah, it's been really fun so far. I said that before, I know, but really, like, if you ever get the chance to apply to an internship, like a nurse internship, I highly recommend it. I think it's a great opportunity, and it really has helped me kind of with all my skills of like critical thinking, kind of getting used to like being a nurse, being there, for more than once a week. So I really like that. And yeah, so I hope you guys have an amazing day. If there's anything you want me to film, please let me know. Yeah, I hope you guys are having a great summer, treat yourself. And then if you're in school right now, I'm very sorry. Yeah, but yeah, have a great day. Thank you guys, bye. Okay, while I'm out here too, I wanted to ask you guys a genuine question because, being in the hospital so often and washing my hands so often, my hands have gotten so dry and like so crusty looking. And I try everything, like I try to exfoliate with a washcloth. I will, like just moisturize with like oils, really like heavy creams and like crack repair stuff, and like nothing seems to work. Like, I want to show you guys a little bit. I don't know if you can see. There we go. That's kind of, I'm sorry if they can't really see. But just like flaky, and even, oh, a bug, even on my palms. It's just gross, and I hate it. So if anyone has any recommendations, I would really appreciate it, because I don't want crusty hands. So yeah, let me know, please. Okay, thank you.